promised, Dr. MattWallis from the RegenerativeCenter is here with me, and we're going to talk about chronic pain and how to deal with that. You ready?
Ready.
Okay, so what's the difference between chronic pain and maybe that snap, crackle, pop I hear in the mornings when I'm getting up?
Well, you know, that's good. I think the problem is that, you know, nothing's really changed in the 25 years that I've been doing this now. That I think our Western culture, our healthcare culture, all of it together has really caused us to think so much about pain. And we feel pain. Pain's a real thing, but the deal is pain can't create itself. But our whole system, I think insurance companies really force this on us because of how many treatments and what we can do and all these things. It forces a lot of clinicians to make these decisions, and we get trapped in this thing of, you know, please get rid of my pain. But pain is just a messenger. It's trying to tell you there's a problem. So at our center, our focus is trying to get to what is causing the pain and trying to find solutions to rid the problem so that the pain goes away.
Gotcha.
Does that make sense?
Yeah, so instead of just, you know, maybe I might have an ache or pain that ibuprofen would take care of for a day or two, but if it's consistent or persistent,
right,
then we need to get to the root of what that problem is.
We need to get to the root of the problem, and I kind of got an example here to just kind of help illustrate something. So this is just a spinal joint, okay? So this is a very degenerative joint. There's arthritis, there's a bulging disc, there's ligament damage. Well, guess what? This is going to cause pain. You're going to have pain with this. But if all we do is give a pill or a therapy or something to reduce the pain, as soon as the therapy's over, you still have the same problem. So, and also with this problem, you're going to have muscle spasms around this joint. So now you have not only pain meds, but you have muscle relaxers, or you have to go massage all the time or something. And then third, you're going to have inflammation. Well, now you have anti-inflammatory medications.
Right.
And so this person is now stuck and trapped in this pain cycle. And still yet, the problem is still there. We try to find out solutions and build protocols to resolve this problem, and not so the patient doesn't have to be stuck in this chronic pain cycle.
Got you, which is better for us because taking those things over the counter or even something a little stronger, it's not good for our gut health and things like that. So we're just causing other problems trying to mask this problem, correct?
Very well said. I had a patient this morning and I said, what is your goal? And I'm so happy when they say, you know, my goal is to fix this problem. I'm tired of the medications, I'm tired of the therapies, it's expensive, and I'm not getting anywhere. But I've also caused other problems now. I'm having to treat these other situations. So treating pain is a real thing, but again, pain cannot create itself. There must be a cause. And if we can eliminate these causes, we're helping a patient to not create other ones.
Okay, so what do you do to find that problem?
Okay, so it would start with, we'll use this model again. If this patient came to us, we would see, okay, there's ligament damage, there's a disc that's bulging, there's inflammation. So we would build a protocol. So one of the pieces of a protocol for something like this would be decompression. Decompression is a proven treatment that would decrease the pressure in this disc and invite water to rehydrate this disc so this joint's moving and flexible. Second is these ligaments are failing, and they're never going to get better because they have no blood supply. So we would actually have to get some healthy cell and transplant it into these ligaments to help to promote collagen growth to get this stable again. And then as far as function, after this is over, that's a good time for physical therapy. But a lot of times people do that backwards. They do the therapy and they still have damaged tissue. So we would build a protocol to solve a problem, and our patients do fantastic, and 90% of them wouldn't need surgery.
Perfect. We're going to take a short break, and we're going to come back for more and finding out how we can get through breaking the cycle. Okay?
Good.
Coming up next, we'll have more after the break on WPSD Local 6 Midday.